I'd like to invite the next speaker, Dr. Poorva Sharda. She is the head consultant at Dharma Atelier Bhopal at multiple clinics across Bhopal and peripheral region. Welcome, Poorva. Now, stage is yours.
Thank you so much, ma'am. Hi, this is Dr. Poorva Sharda. Very good afternoon to all my eminent gynecologists and my dear colleagues. And so we spoke about the anatomy. We have spoken about the pathophysiology. We have also talked about the non-invasive procedures. So my seminar is a very brief seminar in what I do in terms of invasive procedures in dermatology. So let me begin with my table of content. So I'll just quickly be talking about introduction to facial aging. So whatever has been covered, I'll quickly show a short video about it. What are the key factors? Then we'll just talk about invasive procedures like Botox, fillers, skin boosters, and threads. So here is a beautiful video of, obviously AI generated, of a 20-year-old female and how she ages till 70 years old. So please have a look at it. Can you please play the video? Not this one, yeah. This is a video. I need it to be played. Not this one. This is a video. Yeah. This is a video. It didn't get downloaded? Okay, that's fine. Can you check it and let me know? So I can show this video later on. So let's talk about how aging affects the bone first. So bone, as we all know that as we age, there is bone resorption, there is loss of bone density, there is osteoporotic change. So all of our, like the eyeball socket, the nasal socket, the oral orifices, they all increase in size and there is loss of structural, the skeletal support is lost. So if the base is lost, everything above it, all of your muscle layers, all of your adipocytes, everything is going to fall down due to the gravitational pull. Then we have the muscular layer. We know as we age, the muscle also undergoes muscle atrophy. The muscle atrophy is as equivalent to the muscle atrophy happening anywhere else in the body. There is loss of muscle tone. So if you smile, you have crow's feet. If you give a lot of expressions, you have forehead lines. If you think a lot, you get glabellar lines. So because we give a lot of expressions, the tone also decreases. And therefore, we develop what we call as permanent expression lines. Then we have something called as the fat layers. We have the superficial one, and we also have a deep fat pad layer. So what happens as we age, the fat layer, the one which is the deeper layer, it tends to get reabsorbed. It is also a similar case if you're taking Ozempic or if you're going on a crash diet. So the fat, the deeper one, will get reabsorbed and the superficial one is going to sag down upon, and you tend to lose fat over your cheeks, around your eyes, and even around your nose. So your cheek becomes flatter, whereas your jawline, you start developing jowls and it starts sagging. And ultimately, because of oxidative stress, because of UV light, because of inflammation, your skin also starts showing a lot of changes. So hence, these are the key factors: bone, muscle, fat pads, and skin, which play a major role in aging. So let me talk about Botox. We all know what Botox does. It goes and it blocks the receptors of acetylcholine, and therefore the muscle goes into a permanent state where it is not contracting anymore. So first of all, we will talk about the muscle. So we have the basic one is our frontalis muscle. We inject Botox here, and therefore we get a good frozen appearance of the Botox, so all of your forehead lines are minimized. Here is a picture of before and after. You can see in the first picture and in the second picture what Botox has done to the face. Then we also do Botox over our glabellar regions. The two most important muscles which are acting there is the procerus and the corrugators. So we inject a little bit of Botox here, and you can see in the next picture the results. So expression lines have decreased. The patient is looking more younger. The third is your crow's line. The crow's line usually develop when you laugh a lot and also with aging. So we also inject Botox here, and you can see the difference. So overall with Botox, you get a well-rejuvenated, younger-looking face which looks fresh. These are the US FDA-approved indications for Botox. We also do Botox for a lot of other things, like to tone down your masseter muscles, to decrease your gummy smile, to make your mentalis better, and also your platysmal bands. Let me talk about fillers. Fillers are basically hyaluronic acid, which we inject specifically if we have muscle loss and also when we have fat loss, even in cases of bone resorption or osteoporotic changes. It's basically hyaluronic acid, and we usually inject it along our cheeks. So we have the zygomatic arch, the zygomatic eminence, the anterior medial cheek, along the lower borders of your parotid and the submalar areas. These are all US FDA-approved areas for injections. Let's see what a filler has done to a patient of under-eye hollowness. So we have injected, this is before and after, so we have injected fillers along the tear trough ligament, and you can see the before and after. How fresh the face looks now. This is the lateral view of the same patient. You can check the before and after. This is another patient in which again we have injected along the tear trough ligament, and again like a fresher look on her face. This is again the lateral view. We also inject fillers around your cheeks, because cheeks, they do act as an anchor to lift everything up, all your muscles, all your fat pads. So here, as you can see in this picture, this is a female patient. She wanted to have a good triangular face. This is called the triangle of youth, and she wanted a little triangular face. Nobody wants a long, elongated face. So we did. So people have this myth that fillers make your face more pronounced, but in fact, if you do fillers properly, the fillers make it look more slimmer and more youthful. So here is this case. We have also done masseter Botox in this case. The same patient with a lateral view. We also do fillers for lips. Here is a before and after. Again, this patient. Even 1 ml of fillers can bring a lot of change to your face. Here is again a before and after. We do fillers along the chin and jawline as well. So this is a male patient in which we have done fillers. You can see the jawline becomes more youthful, I guess. Here again, she started developing jowls. She's a patient around perimenopausal age, and she started developing jowls. So we have done fillers around her jawline. Another patient. This again, we made her face look a little slimmer. So we have spoken about fillers which mostly acted upon the fat pads, the muscles. Now let's talk about skin boosters which actually act upon the skin quality. So the skin basically gets attributed to 3 fundamental things. That how your skin feels, that means how your skin looks. Does it look rough? Does it have fine lines? How you feel, how your skin looks in terms of pigmentation, redness, if there is loss of radiance, and how your skin is moving. That means if there is crepiness or if there is sagging. We know there are two types of reflection. One is the specular reflection, we have all studied in physiology, and then there is diffuse reflection. So if the surface is smooth, you will have specular reflection. We will have all the glow which we want in terms of specular reflection. But if our skin is pigmented, it has a lot of crepiness, it is rough, we will have diffuse reflection. That means you will not have glow to your face. So what skin boosters do? They will give you a good collagen booster so that your skin becomes more smoother and you will have a better reflection of light and hence the glow. So this is, can you see, can you appreciate the quality of the patient? This is a before and after in terms of skin booster. The quality of the skin has improved, even the pigmentation has gone better. This is again the same patient with a lateral view. This is before and after. The quality of the skin has improved, the crepiness has improved, the fine lines have improved. Even our skin looks more radiant and brighter. This is a male patient in which we have done, again, skin boosters. You can appreciate the minute changes, and overall the face looks fresher. Again, a patient of skin boosters. Let's come to threads. So basically, threads, they act as an anchor and to stretch up. So I don't do threads in my practice. I only do threads when I need an anchor. I'll do threads first, and then I will put something like a filler or a Botox, and threads will just act as pillars. They will give strength, and then hence we can add like more fillers to the patient.
Dr. Poorva, please conclude.
Yeah, ma'am, just two more slides. Yeah. So there are different types of threads. We have the mono threads, which are the normal threads, and then we have the cogged variety. And we use a lot of threads, if you have eyebrow drooping, you would inject cogged threads. Or if you have drooping of your nasolabials, we would again do cogged threads. But these are all the indications. There are abdominal threads also along the platysmal bands, along your Nefertiti. And hence, this is how I conclude my presentation. Do we have that video? No. Okay, thank you. Okay, thank you. Thank you.
Good, Poorva. I have one question.
Yes, ma'am.
You use lots of Botox. Is there any difference? What brand you use usually, commonly, or you believe on?
Ma'am, I usually
Original.
go with Allergan
Allergan,
Botox.
original Botox.
But
Because
I-
now, previously only Botox was available from Allergan. Now many companies are.
Yes.
Is there any difference? Have you used some other brands or only Botox you are using?
Ma'am, I feel I also use Dysport. So I do a lot of non-US FDA, like I also put Botox in migraines. So there we need
Other
200 units.
indications.
Yes, I do that a lot. So we do put a lot of Botox. So if
But
it
for
all-
aesthetics you use, for facial aesthetics you use Botox.
Mostly, if I have a female patient who is affording enough, I would use Botox. But it also all depends upon the patient's pocket as well. But I also do use Dysport and Nabota.
Okay.
Yeah.
For vaginismus, I think only Botox is approved, FDA approved. Other Botox are not, other botulinum toxins are not approved for vaginismus.
Yes, ma'am.
Thank you very well
Thank
done.
you so much, ma'am. Thank you.